All right, so now we are going to focus on the third learning objectives where we'll be discussing addressing inequities through policies as well as policy application and looking at a couple of policy analysis frameworks. So before we go into it, it's important to kind of explain what subpopulations are, because to be able to really do policy analysis, to be able to use a policy analysis framework, it's important to look at subpopulations in such a way that you use policies to address inequities or to reduce health disparities. So, what are subpopulations? They are distinct groups within a larger populations, and what makes them distinct is because they share specific characteristics such as race, ethnicity, socioeconomic status, in terms of also geography, gender. There a these characteristics that they share, and usually that characteristics does make them more vulnerable than the larger population. So, these subpopulations often face health outcomes that are different from the larger populations, and the disparity in the health outcomes that they experience is typically due to socioeconomic and environmental factors, or all three of them. So, examples of subpopulations that are affected by health inequities would include racial and ethnic minorities that typically experience higher rates of chronic conditions. And then you have low income individuals who have increased barriers to preventive care and have either don't have health insurance, or when they do have health insurance, they are underinsured, meaning that their insurance doesn't cover enough of the healthcare services that they need. And then we have rural communities that often have limited access to health facilities, or where they are health facilities, they usually have experienced such shortages in terms of the providers that are going to offered in the services, as well as having transportation challenges. And then you have older adults who, due to being more prone to chronic conditions and other health related diseases, tend to have worse health outcomes as a result of their age. And then you have individuals with disability, not just physical, but both physical and mental disabilities that often face physical and systemic barriers to accessing healthcare services. Some of these barriers are physical or structural, in terms of where healthcare services are located, or healthcare facilities are located, or even within the healthcare services, whether accommodations or accessibility efforts have been made to make sure that they are able to access healthcare services. So, why is it important to look at subpopulations, and why is that relevant to health inequities? So, health disparities often emerge within these subpopulations because social determinants of health affect them differently. And systemic barriers also tend to impact them in a more negative way than it impacts the larger populations. And so, it's important that health policies, or policies in general, and interventions need to pay closer attention to the needs of these subpopulations in order to be effective, especially if the intention is to address health disparities. So, what are some of the policy implications that come in as a result of subpopulations existing? It's very important that policies really work hard towards addressing specific challenges of each subpopulation. It is not a copy and paste thing when it comes to policies, especially if you're trying to close health inequities. There's a need to recognize different challenges that each subpopulation experiences, and as much as possible, try to address those challenges. So, where there is equity focused policy analysis, what it does is that it helps policy professionals or healthcare professionals to be able to ensure that interventions that are designed or interventions that are implemented are really working towards reducing disparities rather than unintentionally perpetuating them. Because if there is not extra care that is taken, a well-intentioned intervention may end up exacerbating existing vulnerabilities if it does not actively acknowledges it and works towards addressing it through policy. It's also very important that there is collaborations with healthcare systems. In When we talked about managed care, we really put in a lot of focus on stakeholder in collaboration and stakeholder engagement. This is also how it is works with policies in general, whether it's under managed care or outside managed care. There's a very high need for collaborations between all the stakeholders that are involved. This is both on the policy level, organizational level, as well as community level, as a way to come up with a means of addressing the root causes of inequities for each population, subpopulation. So, what are the ways to address disparities across subpopulations? It's important that interventions are targeting structural aspects that increase the vulnerability of subpopulations and looking at it in terms of environment, neighborhood conditions, as well as access to nutritious food. So for a intervention to be successful, it needs to consider individual capacities within subpopulations, as well as considering community-specific characteristics. Like I said, with interventions, it's not a copy and paste. It's very, very important that you are tailoring it towards the needs of the population or the subpopulation. It's also, I've talked about collaboration. This is very, very important with subpopulations also because you need their engagement, you need community engagement. There's a need to build trust within members of the community as a way to get their buy-in. So that's why it's very important that there is collaboration that is designed into any intervention. So, what are the roles? Right now, I just kind of want to talk about the roles that health policy plays in health equity. So, I'm not really going to touch on it a lot, but I just kind of wanted to mention it that when it comes to health policies, they shape access, they shape affordability and quality of quality of care in a way that making changes to individual levels of determinants of health does not, or making changes to community level determinants of health does not. Health policies have a way of reaching more people and of making more long-term changes. An example would be managed care system that when it came in, it made a lot of changes with disease management as well as preventive care. So and it does it in a much more larger macro way than any individual changes that could be done in terms of interventions that are happening on an individual level or interventions that are happening on a community level. So policies can reduce and or reinforce systemic barriers. So that's why it's important that when you are designing a policy, you are considering the fact that policies can be a double-edged sword. It can do both good and it can do harm. So it's really important to look at policy from that angle, trying to understand, okay, how are all the ways that it can improve, it can reduce systemic barriers, and how are some of the ways that it can also reinforce systemic barriers, whether or not it was intended or not intended. With policies, sometimes they have the intended positive consequences, but some of the times, unintended negative consequences does happen as a result of policies. So, a policy that was very good would be the Affordable Care Act that increased coverage for low income populations. However, Affordable Care Act, while it made a lot of great efforts to improve provider access, increase providers in rural communities, did not quite do it as successfully as increasing coverage for low income populations. However, the another example of there being a positive on one hand and not so positive on the other would be the health insurance mandates that was able to improve coverage for some people, but also made things more financially burdensome for others. However, the Supreme Court was able to say that it wasn't constitutional, and because there was a time when they had this individual mandate where people had to have had to have some form of insurance, or there would be there's some kind of a penalty for not having it. The Supreme Court was able to strike that down, but that would have provided some form of financial burdensome for those who choose not to have health insurance if that hadn't been done. So, through managed care, but also other health policies, there have been policies that have helped in addressing preventive care and also chronic condition management that has, been helpful in reducing disparities in long-term health outcomes. Some of these policies have worked very well in general populations, but are still not working as well with subpopulations. So when we are looking at the success of of a policy, especially that one that is on the national or state level, we need to just not just look at it in terms of the general population, but also examine it as it relates to subpopulations. um there's state and federal support that has, through funding and policy initiatives that have been very good at tackling disparities at scale. But like I said, some of the times it does it at scale for the general population, but does not quite do it as well for sub populations. um, One of the examples of how it doesn't quite do it as well would be the variation in an example would be Medicaid expansion that was different in different states. So not just that not all states expanded, but even within the states that expanded Medicaid, they did not have the same benefit packages. So in states that had more generous benefits than others, they were able to address inequities or disparities better than states that had less benefits. What that then meant was that it introduced geographical inequities to health access. That became dependent on which state that you live in. Whereby, if you live in a state that has very generous benefit package, your health outcomes are likely to be better. Versus if you lived in a state that maybe did not expand Medicaid at all, or it expanded Medicaid but with minimal benefits. So where there are a couple of healthcare practices that address or perpetuate health inequities. One of them would be those that address it in terms of helping towards reducing it would be having cultural and linguistically appropriate care in order to meet diverse patient needs, having community workers program for care coordination, but also to get patient engagement. Like I said, people like to see people that look like them, speak like them, understand the thing that they say. It builds a trust within communities to know that you are interacting with people that you feel a sense of familiarity with. You trust them. It's usually very important to have those sorts of programs. It increases care coordination, but also gets more patients involved, and so they're more likely to adhere to recommendations or interventions, and participate in those programs. Telehealth services has also been very good with increasing access in rural and underserved populations. Implicit bias training is also one of those things that have been good with reducing disparities with care delivery. Like I mentioned before, and I just kind of want to reiterate it here, with implicit bias training, it's important to um, get people to understand that anyone can have implicit bias. Just having implicit bias does not necessarily make you the bad guy, but being aware of some of the implicit biases that you might have helps you to be able to address them. And when you are interacting with patients that are in the community or in a population that you may have those implicit biases with, you're able to check yourself and you're able to pay closer attention in how you are delivering healthcare. So integrated care model, I've also mentioned it in terms of why it's important to have physical and behavioral health integrated in such a way that people know that when they go to healthcare services for physical health, there is some attention that is paid to the behavioral health, so that it doesn't wait until the behavioral aspect of it becomes uh, unmanageable, or it gets to the point where it becomes quite difficult for them to be a functioning member of the society. Then you start seeking behavioral health services on its own. So when there's integrated care between physical and behavioral health, they are able to stay within the manageable level or preventive care, so that things does not escalate and get worse. Cross-section collaboration is also very important when it comes to addressing social determinants of health. And also is particularly important with improving health outcomes for vulnerable populations. What are the practices that perpetuate inequities? Implicit bias, having that leads to differential treatment, which is why implicit bias training helps to address that challenge. Like I said, anybody can have implicit bias. That it itself does not necessarily make you a bad person. Is being able to acknowledge that implicit bias that you have and working towards addressing it within yourself, and also trying to working towards making sure it does not impact your services that you provide to patients. Limited diversity among healthcare providers is also very, very challenging in terms of it does perpetuate health inequities. Like I said before, people like to interact with people that look like them, speak like them, understand the things that they understand. Where there is limited diversity within healthcare providers, it leads to some patients not fully trusting healthcare service, and possibly waiting until things get too bad before they can seek help. But also, when in where there are health providers that there's diversity, it also helps in really pushing for cultural competence and reducing possibilities of implicit bias. A fragmented system also creates barriers, particularly because it affects care coordinations and healthcare providers that are not speaking to each other. Insufficient reimbursements for preventive and behavioral services is also something that perpetuates inequities, which is something that the Affordable Care Act really did a good job in trying to push for behavioral services, and also trying to reduce some of the barriers that existed with insurance companies with when it comes to payments and reimbursement for behavioral services. Lack of transportation, care, child care, and flexible work hospital clinical appointment times is something that is a problem, particularly for low income individuals, particularly for low income mothers who cannot afford to live on one single income home, and they have to work, and they often may not have jobs that have maternity packages, and therefore they have to return to work as quickly as possible, but they cannot take their children to work because usually the kind of jobs that they get do not have those benefits with it, which then reduces the ability to earn as much money and also to fully have attention, pay attention to their newborn and infant. So that is one of the ways when you don't have, when there's policies that doesn't go make efforts to create childcare, it ends up affecting the health of the children who may, as a result of there not being adequate and safe childcare, being exposed to hazardous environments, but also reduces the mother's ability to earn as much money as she can. So, in order to fully examine policies and look at how it may be perpetuating inequities or how it may be addressing inequities, it's important to analyze policies through frameworks. So, we're going to talk about a few frameworks. We're not really going to go in depth with it, it's just more or less like an introductory uh, um, class in it so that you understand that these frameworks exist and have a kind of a foundational information or knowledge about what they are and what they do. The first will be the social ecological model, which is you guys would have known about. Is one of the most common uh, um, theoretical framework that it doesn't just work. We don't just use it in policy analysis. We also use it in understanding social determinants of health. But just kind of note this works with policy analysis as well. So social ecological model focuses on the interaction between the individual level, interpersonal level, community and societal factors, or how it affects healthcare. It recognizes that health behaviors and outcomes are shaped by both personal choices and broader social um, um, environment, the ecological side of it. So the framework has different levels. We have the individual, where we're looking at knowledge, attitude, and behaviors. Interpersonal, we're looking at social networks and support systems. Community, looking at relationship among organizations and institutions. Societal, we're looking at policies, laws, and cultural norm that shape our health outcomes. The ways that a socio-ecological system can be applied or has been applied in health inequities is looking at ways that ways it has helped identify barriers and opportunities at multiple levels, and also the socio-ecological module has guided interventions that are designed to address both personal behaviors as well as systemic factors. So this is an example. This is a diagram of the socio-ecological model. I'm sure you guys have seen it 1,001 times, but these are the different levels of it. Like I said, individual, interpersonal, institutional, community, and policy. You can just look at what we mean when we talk about that. A lot of the socio-ecological models kind of look a little bit different. So if this is a little different from what you've seen before, they are all looking at various levels of that health and behavior and environment affects one's health. And then we have the health in all policy approach. I have included a very brief YouTube video that you can watch here. It's about 5 minutes. It does a really, really good job of explaining what this policy framework is, so that you can understand what it is about. So this approach integrates health considerations into decision making across different sectors. So it's not just decision making by individuals, it very much emphasizes the role of government in integrating health considerations into decision making in all of these different sectors. So it really, really emphasizes cross sector collaborations in order to address social determinants of health. It recognizes that policies outside healthcare systems does directly impact population health outcomes. So health is one of those that everything builds upon it. You're not healthy just because you're eating wrong. You're healthy because you have places that you can walk from your home into a place to go get fresh fruits and something, and then you walk back. Walkability, all of these things that one may not think, oh, this, having a where to walk may not look like it's health related, but it is health related, and it's not health related in an indirect way. It is directly health related. So that is what the health in all policies approach focuses on. An example of how we are integrating health considerations would be with the idea of improving public transportation with the mindset that it increases healthcare access and it reduces missed medical appointments. Then the last policy analysis framework we're going to talk about is the equity focused policy analysis. I also included a short video here. This is more of a lecture-ish looking video, so you can watch it, but watch it knowing that it has a lot more content in it than that is introductory. But if you want to watch it, I would recommend that you do. But if you don't want to watch it, that's fine as well. So this policy this framework really focuses on analyzing, evaluating health policies, but from the lens of subpopulations in terms of looking at whether it is reducing health disparities or if it's exacerbating it. In the sense that is it doing more of the harm than it's doing the good, or even if it's doing harm, recognizing what the harm that is doing and looking at ways that to address or reduce the harm that it could potentially be doing. So it considers both the intended and unintended effects of policies, making sure that marginalized populations are benefiting from health interventions or policy interventions. It uses aggregated data to assess differences in outcomes between different population subpopulations to see in what ways the policies are affecting them, because the policies may be great for one, for the general population, but for the subpopulations it's really harming them, or it's doing more harm than it's doing good. So what it does is to ensure that interventions are tailored to address unique needs for community needs, particularly for sub populations. So this is an example of a equity focused policy analysis. This would be the intersectionality based policy analysis framework. I have included a link to this that looks at the application of this framework to COVID-19. So you guys should read it up. You're going to use it in your assignment, so I would really suggest that you read it up and look at it in terms of some of the questions that this policy analysis asks in terms of what is the policy problem, how does this problem affect different groups, where and how do we implement this policy, and looks at things like the long-term or short-term solutions. So we're going to end this lecture by looking at ways that policy has been applied in practice. I'm going to this is a couple of them. We looked at socio-ecological model, looking at an example with Medicaid expansion and health access. I've included the objective, policy focus, and then looked at how policy analysis framework has been used in it. So you guys should just read it up so that you see a practical application of policy analysis, and then look at the outcomes and also this is for the health in all policies approach. Here I'm kind of focusing on rural health access, looking at the objective, which is to integrate health considerations into policies across sections to address social determinants of health. Look at the policy focus, look at the applications, and also to have a look at the outcomes. And then finally, this is a policy application of the intersectionality-based policy analysis. With this, we're kind of looking at it in terms of maternal health outcomes for women of color. This is the objective, this is a policy focus, and the application is to reduce maternal mortality and improving health outcomes. So these are the different ways that it's been applied, and this is the uh, outcome, a potential outcome from it. So that is where we end for today's module. I hope you've been able to have a good understanding of vulnerable populations and how policies may affect them, and how we can mitigate that. If you have any question that is related to this lecture or